Hey, welcome back to another episode of What's Up Docs, where we discuss what's hot in the world of social media and physicians. We are here again with me, Disha, from the Frugal Physician, and Dr. Tarang Patel from Dr. Money Matters. Welcome back, Tarang.
Hey, welcome, Disha. Obviously, the world has changed quite a bit in a week.
Yeah.
Obviously, everyone's talking on physician media about COVID-19, coronavirus, and it's a pretty bleak picture that we're seeing. I mean, whether we're seeing it personally at our the facilities that we work for, or whether we're right now kind of bracing for what seems inevitable. Um, it's definitely bleak. I know a lot of physicians have been talking about this kind of from a distance, seeing what was happening in Italy, what was happening in China, and we were just we were just waiting, and unfortunately, it's here.
Yeah, I think we were complacent initially because we're so used to containment, something terrible happening, like a terrible virus or a terrible disease like Ebola or SARS, and it gets contained and it didn't become a pandemic.
Right.
In our recent lifespan, I remember being so afraid of Ebola because my husband was going to deploy at that point to Africa to help with the Ebola containment. And his troop did go, but we got that contained. And the problem with this virus is that, Ebola tended to, if you got it, it would kill you, and because of that, the hosts weren't spreading asymptomatically,
Right.
whereas coronavirus, there's so many hosts that spread. So it's the volume of people that are infected with it. And that's our problem, right?
Yeah, I mean, I just before we came on, I just saw something posted in one of the groups talking about the versus the flu, where exposure to onset is about 2 days on
Mm-hmm.
average. The median for COVID or coronavirus is about 5 days, and it can go up to 14 days
Right.
where you show symptoms. I think 99% show symptoms by the 14th day, which is why everyone's talking about this 2 week incubation
Quarantine.
or quarantine. Sorry, 2 week
Mm-hmm.
quarantine, and so it's frustrating. When you see pictures, like I just saw in Florida, people on spring break, beaches, packed, full of people on spring break. And I get it. I mean, no one wants to ruin plans, but at the same time, it's Florida's going to get hit extremely hard. I'm a little nervous. My parents live in Florida. Obviously, they're elderly, and if Florida is overrun by sick young people, which it's not. I think a lot of people in their 20s and 30s feel immune. Well, we're seeing a lot of data saying that they're being hospitalized too.
Mm-hmm.
They may have better survival rates, but they are still being, intubated and, being under critical care. So
Right.
it's definitely a frustrating thing to see that.
I know my brother-in-law, like we're in New York, and we're like the epicenter now of
Right.
this infection, and he has symptoms, but he didn't get tested because they're not severe enough for testing, which is
Right.
a problem, right? Because unless you prove to someone that they have COVID, they won't believe it. He's like under the impression he has strep throat,
Right.
and then he's still going out, even though, we're supposed to be sheltering in place. He's going
Right.
out everywhere.
Yeah.
It drives me insane.
It's I can understand that. I think I've had to reach out to family members too who are non-medical and explain to them the importance. Luckily, we have a bunch of medical people in our family, so it kind of drowns out some of that noise. But yeah, it's tough, and it's I don't know. It's frustrating seeing it because now, like we said, we saw it from afar. What was happening in China, that seemed far away because it was on the news, right? We saw pictures and things like that. But now, and then Italy was a little bit more geographically and culturally close to many Americans. And then, but usually you're right, we've avoided the the oceans seem to have protected us from many, many things. Well, obviously that's not the case anymore. And Seattle got the first wave. California had a big one, and then now New York is definitely, the cases have the number of positive cases have exploded in New York over the last day, but that's only because they're testing there. My state, Arizona, has been very difficult to get testing done, and I've heard numerous complaints from hospital physicians around here who are saying that they have patients who they're trying to test, but the state government regulates the testing of inpatients,
Mm-hmm.
and it takes so long to turn it around, takes so much justification to get a test that we know it's woefully underreported. The last I saw, and I haven't seen the statistics this morning, and obviously things are changing rapidly, we had 27 cases, which there's no way. We have to have significantly more than that. And so it's frustrating because as healthcare professionals, we know what's happening. And
And we're on the front lines.
Yes. And to be quite honest, we are being let down by our leadership in the government, A, who are non-medical, but, and B, some of them who are medical just don't have enough pull to impact what's really happening. So I wouldn't be surprised that the, departments of health at various states may have pushed for more testing, but they're getting blowback from the other politicians because they don't want to scare people. Like the governor of Florida doesn't want to shut down the beaches, or, it was a big decision in Arizona to cancel spring training. They did it, but they still haven't, done as much as other states have.
Right.
And we also have an elderly population in this state. So,
yeah. And talk about being let down. Talk about PPE. I mean, personal
Yeah.
protective equipment. I mean, we look like the third world compared to what the doctors in China and Italy have been wearing. They have head to toe PPE with N95 respirator masks or complete occlusion, I'm
sorry, I was just going to say, you're absolutely right. There's pictures going around on Facebook in the various COVID physician and advanced practice provider groups. And these are worldwide groups, 75,000 people or more in some of them, showing the, what the physicians and care teams in China had. Like you said, they look like spacesuits. They're fully gowned.
Mm-hmm.
And we're hearing from physicians here now that are being asked to reuse N95 masks for a week in some cases.
Right.
Get one mask. What is that? That is unbelievable to me.
I know. And then I've seen articles about them actually saying, oh, well, maybe we can just make homemade, bandana masks.
Yeah.
Seriously?
Is this World War II? What's going on?
I mean, I thought, we were the United States of America. Come on, like we can ramp up production. Like what's the problem?
Yeah. On the good news side, I did see some talk from General Motors, Elon Musk of Tesla, talking about converting some of their, idled factory space to make ventilators. Some other companies, alcohol companies actually, are repurposing their distilleries to make hand sanitizer, which is, great. So in these difficult times, I feel like we're not going to be able to rely on our government. And so it's great that social media has let, all these other industries know, and they're helping us out. So, maybe a little bit, not as fast as we'd like it, but, help is coming, I hope. But boy, it's been a really dark week on physician social media.
Yeah, it really has. I mean, I've heard so many doctors, close and far, just tell me about how afraid they are to go out on the front lines. And, people are making plans for their families in case something happens, and I think that's important. I do think financially we need to prepare for that and, make sure we have wills, and make sure, we have a binder or whatever, something, a legacy binder with all of our passwords and account information available. I use LastPass, so, if somebody uses my computer, they can get into all of the accounts, and my husband has everything. But, it is scary. It's scary.
It's frightening. And so many stories about physicians kind of, especially if they're in a situation where there are two physician families, or even one physician family but one person who's working, they're kind of having to separate their families. This room that I'm in right now is my pseudo COVID isolation room, because when I come home now from work, and I'm a radiologist, so I'm not as exposed as many of my other colleagues, but I'm still in a hospital that's going to have cases. We're the largest hospital in Arizona, so we're definitely going to get cases. And so basically the mindset is you come home, you change in the garage,
That's right.
you and I don't wear scrubs to work, but I change into the hospital scrubs, and then you change back out into your regular street clothes. You come home, change in the garage, go straight to the shower, and basically, it's unfortunate I'm having to limit my interaction with my children, because of that, and I'm a little concerned. And I know children do well, and it's okay, but it's not perfect. We don't know everything about this stuff yet, and because we're continuously exposed at work, you don't know each day that you go to work, that incubation period starts again.
Right.
So, it's again, I've read stories online about dual physician families who are having to separate, or send their kids to live with one of their parents or something like that. Which in of itself can be a little bit risky, because kids are great vectors for this disease.
Right.
So it's brutal. I
It's
didn't
brutal.
think it was going to get this dark this week, and it really has been. And we're not even at I guess we're at the first wave. If you look at New York and Seattle, most of the rest of the country is still bracing.
Right. And we are on the upward exponential curve right now.
Yeah.
Hopefully there are enough people out there that are self-isolating and following guidelines to actually mitigate the spread of this virus.
Right.
Hopefully. But yeah, it's looking pretty bleak. But let's talk about something positive. Let's talk about
something positive. Absolutely.
Let's talk about how telemedicine has been freed up, that we can practice across state lines now, right?
Yes. So
I haven't seen that actually implemented, but
right. I haven't seen all the details of it, but basically
he announced that anyway.
Yeah, he announced, and he, of course, being the president, announced that we're going to get rid of a lot of these regulations. Telemedicine right now will be reimbursed at the same rate as an physical visit by Medicare. Of course, our friendly helpers, the insurance companies, are very slow on the uptake, and that's not a surprise there. But that, I'm sure at some point they will follow, because they absolutely have to.
Right.
And if they don't, that's just going to push us more towards a nationalized health system, because this is the time where they're supposed to demonstrate their worth. So insurance companies, if you're watching, we know what's happening. But anyway, so there's that. And then there's supposedly eliminating the need. If you have a state license in New York, like you do, you could, in theory, treat patients in New Jersey, Arizona, wherever. And I'm assuming it's via telemedicine. Used to be telemedicine, you had to have an existing relationship with a patient. I'm assuming now that's not going to be the case. So this is definitely a boon for the telemedicine companies, telemedicine platforms. But even more importantly, now they're allowing just FaceTime or Skype or Zoom to be considered telemedicine legit platforms. So you don't necessarily have to have a telemedicine company to do this. Again, we'll have to look at it. But and I know there's a lot of billing. And of course, malpractice ends up being a whole different coverage issue. We don't know how that's going to work yet. But
right.
So I think the good news in this setting is that after this crisis is over, and it will be over at some point, I hope that a lot of these streamlined rules stay in effect, because that to me is one of the questions I always had. Why do we have different state medical boards?
It's not like medicine changes across state lines.
Yeah. I feel like it's just to give jobs to people. That's all.
Right.
but you know, that's even fine, but the fees are so expensive, right?
The doctor tax. It's the doctor
Yes,
tax.
yes, exactly.
Yeah. Yeah.
So
I mean, I think, it takes a push, especially for medicine where we're so resistant to change,
right,
that it's interesting because, we're resistant to systematic change because,
yeah,
I think part of that's because of the high, um, amount of liability we have to carry, and it's complex decisions. And if anything in our daily routine gets even thrown off just a little bit, it can
right.
affect a lot of people, seriously, but it takes something like this to push everyone into the progressive direction, and adopt new technologies, and hopefully the older generation of doctors will also adapt telemedicine, and it'll become more of a thing,
Yeah,
because I think that's what patients want. In the end, patients
I
want,
think.
at
Well,
least the
you,
younger
I
patients
was going
want
to
it.
say, you might know better than this about me. I
Yeah.
mean, in radiology, we've had teleradiology now for
Hmm.
nearly 20 years. Obviously, it's improved as bandwidth has improved. But yeah, I've seen stories now of, partly just to limit the utilization of PPE, is that, in the ER, they're doing FaceTime, even when the patient's there,
Hmm.
or in ICU rounds, things like that. So I think that's been one of the really good things. One of the other good things, since we're talking good news, is seeing some of the ingenuity that's come out of the, what do they say? Necessity is the mother of invention. People have come up with some brilliant workarounds due to the shortage of equipment. I saw someone talking about using, lengthening IV tubing so that the pumps can be put out in the hallway.
Outside of the door. Yeah.
So they don't always have to go in and put on, all the equipment just to go in the patient room. And I was like, well, that's brilliant. Like that
Yeah.
seems like a very simple fix.
Right.
So and there's threads just chock full of good bits of practice. And the amazing thing is, like, in radiology, we've got a lot of discussion going nationally about different, best practices with people from, Mass General, Stanford, community hospitals. And it's been a tremendous thing. So I'm assuming that's the same case in all the different fields. So I think if one of the positive things that we can take away is we're all feeling much more united as a community of healthcare providers.
Yeah, absolutely. With the IV tubing, I do worry about, that the eyeball check on a patient, what if that line comes out of their arm,
Sure.
and the patient's asleep and the
Sure.
medicine's just dripping all over the floor or
Right.
whatever. I mean, I think it would be important to reinforce that, hey, you just open the door and look at the patient and make sure
Right.
everything's okay and talk
Or
to them.
that might be maybe where we have more cameras, right, on the patient.
Right, right.
So, you don't actually have to physically go in, but maybe have camera where the IV is and on the face and stuff like that. Yes, you're going to lose privacy, but this is going to be one of those scenarios where we all lose a little bit.
Yeah. Absolutely. We are kind of all of a sudden really quickly devolving into this like Big Brother state, aren't we?
I know. I know.
How did that happen like within the
Well,
span of 2
that
weeks?
if you go into that part of it, I mean, my goodness, a lot of people, there's a lot of conspiracy theories out there and things, and you never know. I mean, we have to get through this part about it, but yeah, some
Yeah.
people are very concerned that this is a way for government to grab power, and basically if they restrict things, and I guess that's maybe why some of the governors have been a little bit more leery about, restricting movement. And I understand it, because once they do it once, it's easy to set a precedent, right?
Mhm. Mhm.
Um, but I don't
Right.
know. I don't know what the cost is. I don't know what the right answer is. I know as a healthcare professional, our thoughts are more, let's take care of our health. We'll let the other ramifications, come as they come. But first thing is to take care of the population. So,
Right. And in Wuhan, I saw there was a video on YouTube, and they were welding people into their apartments.
oh
Like
my
they
God.
were, yeah,
Wow.
yeah. Can you imagine?
Yeah.
And I'm not saying that's the right thing to do at all, but they did report today they had no new cases in Wuhan today.
Right. Right. Yeah. I,
So it's like, I don't know, how far do we go?
yeah, exactly. I think these are things that we're going to have to address after the fact.
Hmm.
Let's get through this. But yeah, I mean, those are all bigger questions that I think will definitely need to be answered.
Yeah.
But well, that's good. I mean, I think this is week one of most people's self-isolation. Um,
Mine as well.
yes, I'm assuming your kids are home. My kids are home.
Yeah. Yeah.
So how's that going?
It's bittersweet. It's kind of weird. It's like we have all of a sudden kind of backed up into a simpler way of life almost.
Mhm.
um like we hang out and we do activities, and then we go outside a lot. We can't go away from the homes. We can't have the like the scheduled things that we
Right,
do, the piano lessons and blah blah blah. So it's more just we're getting a lot of good family bonding time, which
right.
is cool.
Yeah,
I do enjoy that.
my kids did a virtual violin lesson this week because their instructor, we have the same teacher comes for all three of my girls,
Oh.
and she actually comes to the house. But this week we're trying to do it, so she did it via Skype. It's not 100% perfect, but that's all right. This is we're gonna figure this out. But they got a ton of homework from their school this week, and I feel bad for the teachers across the board because they don't know. This is a unique situation. So my
Hmm.
kids go to this intensive charter school, and they just got loaded, and they're like, "Oh my gosh!" But now, I think they're adjusting the workflow and things like that. So, I think we're going to get through this. We're going to look back on it and be like, "Wow, that was a amazing time in history." And but right now we're in it, so let's continue the precautions. What's the term? Shelter in place.
Hmm.
Uh,
Right.
yeah, I just saw a tweet this right before we came on, where all these celebrities who are doing the same thing sang the John Lennon song "Imagine," and it was like oh gosh, Will Ferrell, a lot of the SNL people, the two women who played Wonder Woman, and it was just like John Mayer, like a bunch of these people. So trying to just encourage people to kind of stay at home. By the way,
That's great.
do you have enough toilet paper?
Yeah, I went grocery shopping when I got back into town, and yeah, our Hannaford was totally out of toilet paper
Oh
and like
yeah.
all the essentials like milk and whatever. And then I actually went to Walmart and they were actively restocking stuff. But I also heard of a fist fight that had recently broken
Oh
out.
my gosh.
It's crazy out there.
It's nuts. Yeah, at our Costco, they're pretty much been out of toilet paper. We've haven't we you know we've had enough for a while, so it's not an issue. But it was just like,
Hmm.
they the line. It was crazy. The line was around the building,
Wow.
and I was like, man, all these people, because a lot of people are going to be losing their jobs, right, during this economy. I was like, why can't they just hire people and have them pack the boxes just like Amazon and then go out and do deliveries? Because people will order online as opposed to, I don't want to go to Costco if I can avoid it.
Hmm.
But
Right. Right.
so I think it's going to change the way we work and live for a long time coming forward. But
Right. That's what, I had signed up for a conference. And when I boarded the plane, the news was just starting. Or at least the day before I boarded the plane, where I was
right,
still reading the news and not frantically packing. Um, the things from Italy were just starting to come in. It was the texts from the doctor there that was being circulated on the internet was
yeah,
starting to circulate, but it hadn't been verified yet. I wasn't sure if it was real or not.
right, right.
And then as I'm on the plane, that gets verified and the WHO declares a pandemic. And
Right.
I'm like, no.
I know. I had the same thing. We were traveling last week, and I had asked about one of our ID docs about this, just because I was concerned, but I wasn't like, and he had told me, and this is not to say anything negative about him by any stretch. It was just, it said that, you're more likely to have an issue at the hospital.
Right.
And I thought, you know what, that's legitimately true.
Yeah.
And so we had planned this, for a long time. We ended up going anyway. While we're there, the news comes out. the NBA season's
Sorry.
canceled. Oh, different. NBA and all
Can we
those
time
things.
out for a
Yeah,
second?
yeah.
Sorry, I just heard a door.
So once we got where we were, basically all the news kind of came out, like you were just saying. So we were already there. Unfortunately, there's nothing we could do at that point. But I was concerned about being able to get back home. And so you had actually texted a good thing to me, like, try to rent a car if you could, because I think sometime last week there was a concern that they might shut down the airlines. And so I did that initially, and then I couldn't get one. And then finally I ended up getting one, but they didn't shut it down, and we got home. But then as soon as we got home, like you were finding, pretty much everywhere was out of everything. Because at that point, people had really kind of, I think last weekend is when everyone really, started freaking out. And so, but anyway, I think, this week we're kind of in it. We're seeing some of the numbers come out. It's, we're, like you said, we're on the upslope right now. Hopefully, the one good thing about the US is we've always, risen to the occasion. I think we will here too, but it's going to be tough. And, hopefully, I just want to salute our frontline physician colleagues, and other health professionals also. They've been out there, and they continue to, do like tremendous work. And I got to say, there's not one health economist out there right now talking anything about physician income, are there? I think that was like the most tweeted thing I had before this week, because I was like, boy, just a couple of weeks ago, you guys had a lot to say about us, and I don't hear anything about you now from you. So,
Yeah.
But I don't want to be petty. I'm not trying to be petty. I'm just saying that we are, we're demonstrating our utility to society.
Yeah. All of the healthcare professionals, and thank you so much for everything that you do and everything that you are going to do in this pandemic for us. We don't hear it enough. Yes, we get a lot of crap about how much we get paid, which, as we all know, for the amount of investment, the time that we put in, it is appropriate. But it is something, just thank you is what you need to hear the most. So thank you.
Thank you. And thank you for what you're going to be doing. And, stay safe.
Thank you.